Thank you, Mr. Chairman, and thank you, Secretary Sebelius, for being here today. I'm also a physician, cardiothoracic surgeon for the last 15 years, and I have a bunch of questions, so I want to try to be brief. You stated that Congressman Ryan's plan puts seniors on the open market. Are you aware that it's designed after the same type of health care plan that members of Congress currently have? And would you call that the government putting members of Congress onto the wide open private health care market?
Yes. I mean, and you are in a negotiated federal employee health benefit plan, but you don't have a fixed amount of money.
Do I have to go to my local insurance agent and with government money and pick my health care plan, or do I have a book about this thick with a multitude of options from which I can choose that have had, let me finish, that have had negotiated rates that are competitive because to participate in the program as a health insurer, you have to be competitive? This is the same proposal that Chairman Ryan has for seniors, and is clearly deceptive to say to the American people that this is putting seniors into an open health care market, when in fact you know that that's not true.
Well, I do think it's putting seniors, right now they can choose a doctor, they can choose a program, they can do multiple doctors. In an insurance plan, often the doctor is chosen for you, the health plan is chosen for you. I would suggest also, though, Congressman, one of the key differences is that the federal government is a much more generous partner to members of Congress in the federal employee health plan than Congressman Ryan suggests to be to seniors in the plan that they would go into. Their voucher system has a much lower buying power than the federal employees do right now, and it in fact decreases over time according to the Congressional Budget Office. So rather than having the lion's share of the program paid for by the federal government, you would actually have the lion's share of the program paid for by seniors.
Well, I think that's still to be elucidated, and I disagree with that premise. I don't think
that's not my analysis. That's the Congressional Budget
Let's move on. You talked about Medicare savings in the Affordable Care Act being against future growth, and you're aware that the Medicaid proposal to the states for block granting, that what you're calling cuts is actually also savings against an unsustainable growth rate, and is actually what you describe as not cuts to Medicare but preventing further growth, and that the block grants are the same thing, and that it would be deceptive to say that this is actually a cut in the Medicaid program if you're calling it savings in the Medicare program under the Affordable Care Act. It's the same thing, right?
Well, the block grant is really the administration of the program, which, if I understand it correctly, would get rid of the direction to protect vulnerable populations. So states basically could pick and choose who to cover and who not to cover. The fixed
Excuse me, they have that ability now, though, don't they?
No, sir. There are some mandatory populations in Medicaid that they cannot drop.
Okay. I want to move on to a different subject. NIOSH is under your jurisdiction in HHS, and under certain responsibilities to the Federal Mine Safety and Health Act of 1977, they are the technical advisor to MSHA, Mine Safety, and recently MSHA has proposed a new rule on coal dust limitations within underground coal mines, and my dad, by the way, was a United Mine Worker for 37 years. We've asked for the background medical information from MSHA and from others, and they've said that that's being denied by Health and Human Services because of patient privacy regulations. And first of all, is that true? Is that the reason why this
Congressman, I really have no. You're saying this is a mine safety standard?
It's a coal dust mine safety standard. They're trying to cut the standard down under MSHA. And
I would be delighted to get you a full and complete answer. I really have no idea.
Mr. Maines also told me he would give us the medical background information on that, and we haven't seen that yet. So and he's saying that that's because Health and Human Services with NIOSH is denying that because it's private health information that you can't give under HIPAA regulation. But you know, we publish medical studies every day with groups of patients,
As I say, Congressman, I will talk to Dr. John Howard, who heads NIOSH, and get you a full answer. I don't know about the mine safety regulation.
What I would appreciate is if we could get the information from NIOSH, giving all of the background on the proposed rule that they submitted to MSHA that justifies this change in a long-standing regulation, which in my view has as a physician, has no medical solid information that it's necessary, and let me say, in my district in Indiana, would be devastating because of the many of the coal mines and others in my state would likely not be able to comply and may have to close, again resulting in a significant amount of job loss. So I'd appreciate that information.
The gentleman's time has expired, and if we could take that for the record. It's a follow-on question.
I'd be glad to. Thank you.